be concerned with their own health. And we're very proud here at the Shops of Riverside because we are honored to be able to present these programs and become a community resource for women and women's health issues and their families, and especially for breast cancer awareness.
This is Dr. Rachel Wellner, who is a breast surgeon, and you are here distributing information about breast cancer. Tell us what women can see here today.
So we have first this general screening questionnaire for hereditary cancer. So anybody who's at risk for cancer given their family history can fill out this questionnaire to determine what their risk is. We have a genetic center that can actually assess those patients more in depth. Second, we have a little notification about our tomosynthesis that we have available. 3D tomography is a type of imaging that we do. It's basically a better sort of a mammogram. It takes a three-dimensional image of the breast, whereas conventional mammography uses two-dimensional imaging. This X-ray screen actually captures and takes various slices and can actually produce a three-dimensional imaging so that we can actually capture early breast cancers a little bit better. Things like calcifications or abnormalities, just with a little more sensitivity.
What are some things that we can do to reduce our risk for breast cancer? And that's men and women, really.
We know that breast cancer, the risk factors are polyfactorial. We know age is a big risk factor, so as women just get older, it just happens more frequently that women get breast cancer. Genetics is also a very big one, so anybody that has a family history needs to really be enlightened as to their risks. So I think that that's a big one. For them, there's preventive medicine, preventive surgery, and preventive surveillance and screening with imaging. So I think those are big. I think, a healthy diet and active lifestyle is very important. We know that sedentary lifestyle, obesity are associated with a higher risk of breast cancer. We know excess alcohol consumption, things like that, are also associated with increased risk. So those are things that we can modify.
There have been so many advancements in the field of breast cancer, research, treatment. What do you think the future holds?
Well, ideally, people like me will be out of a job. Ideally, we will come up with some fantastic medication or vaccine that can eradicate breast cancer. In the meantime, I think our surgical advancements are myriad and wonderful. Now we can do prophylactic surgery. We do breast conservation. We do something called oncoplastic surgery where we can minimize cosmetic defect and maximize the oncologic benefit to patients. It's very important. Advancements in chemotherapy are also monumental. I think that we've gotten our toxicities down and our types of medications out there that really treat a broad array of different types of even aggressive breast tumors. Also our radiation, we've gotten more minimalistic about the type of radiation that we use, things like accelerated partial breast irradiation and dose-dense hyperfractionated radiation that takes a little bit less time out of a woman's schedule when she goes for her adjuvant radiation therapy. So these are the things that are on the forefront, I would say. We're even talking about things like intraoperative radiation therapy, so you give the dose while the patient's actually on the surgery table, so she doesn't have to go for 6 weeks after a lumpectomy.
What do you hope that women take away from the information shared here today?
Early detection is very, very important. I think we've gotten really good about awareness in this country and in the world. I think women are hyper aware of the risks, and I think it's important that they really take into account the importance of early mammography, early detection, any sort of prevention, early screening that they can do so that they can prevent an adverse outcome from a breast cancer. Unfortunately, we still have 1 in 8 women being afflicted by breast cancer. We still have about 40,000 patients here dying from breast cancer, which is still tragic. We're trying to get that down to almost nothing, if not nothing. But we know that early detection saves lives. So the sooner we catch it, the more we can do to save a woman's life and save the morbidity associated with the diagnosis.
This is Michelle Thurber, and she's the general manager